Hello, thank you for tuning into another episode of Take 10 on Tuesday with the Tennessee Tribune. I'm Jason Luntz. Today was a beautiful day. We finally got some cold in Nashville, but I still wanted to get out the office, so I decided to come visit a great businesswoman and physician. I am at Advanced Care Centers with Dr. Alicia Hall. How are you today?
Hi, Jason. I'm great. Thank you.
Well, I really appreciate you taking the time out of your busy schedule to allow us to come here. This is our second time actually sitting down with you.
Yes.
I guess that was about a year or two ago?
Yeah, about a couple of years ago. We were at my other office and
yes,
we were talking then.
Wow, well that's another reason why I wanted to come here. I see a lot of big things are happening. You've moved, you're expanding.
Yes.
So I definitely want to talk about that. But first, I kind of want to refresh people about what's different from your practice than others.
Yes. So we offer a procedure that's not done too many places in the country for people that have an issue with going to the bathroom with hemorrhoids.
Mm-hmm.
And so we offer a non-surgical, pain-free, non-invasive procedure in the office setting where they can come and be treated and be spared from surgery.
Okay, so IRC.
Yes.
What does that stand for?
It stands for infrared coagulation.
Infrared coagulation. Okay. Well, I'll leave that to the doctors. I like the IRC. Now, hemorrhoids is a common problem.
It is very common. Most Americans, 8 out of 10, may experience hemorrhoid symptoms at some point in their life, and so everybody probably has. If you're just living, breathing, walking, talking,
Wow.
Unfortunately, you probably experienced those symptoms.
Wow, and if you haven't, you might in the future, so remember Advanced Care Centers. Now, with hemorrhoids being so common, why is this IRC so rare?
Yes, well, most persons that have hemorrhoid symptoms, the typical course for them is they'll go to their doctor, they'll talk about it. The doctor may prescribe some type of ointment or preparation, and then if they continue to have symptoms, they may go to a GI doctor, get a colonoscopy to make sure there's nothing more serious going on, and then they're saying, well, I still have the symptoms, but nothing serious, so they may be sent to a surgeon, and the surgeon, most times they don't, a lot of them may not want to operate because the post-op recovery is so painful.
Wow.
And so this procedure was invented about maybe 35 years ago by two colorectal surgeons, and so they provided this non-invasive treatment for hemorrhoids, and it's not very well known, which is why I'm glad we're talking today, because the word needs to be out more. People
Yes.
should try something non-invasive first before trying surgery.
Yes. So let's kind of explain that in layman's terms. When you say non-invasive, you mean it's not actually penetrating the body? Would that be?
Right. So with the, first of all, a hemorrhoid vein, which is an enlarged swollen vein, it's like a varicose vein that occurs instead of in your leg, it's in the rectum.
Okay.
And with non-invasive, it means that we would do an exam, and we would apply use infrared light and apply a treatment and beam light into the base of hemorrhoid tissue. And that is a non-invasive or non-surgical approach. So it means that we don't cut. We just beam light into the base of the tissue, and it destroys the hemorrhoid tissue.
That does sound a lot better. I noticed on your brochure and paperwork, you guys call it the gentle solution?
It is the gentle solution, and when you're talking about that part of one's anatomy, you want to be gentle, you want to be sensitive, and
Yes.
give them an approach, a solution for them that's going to help them and help them to have a better quality of life and not deal with those symptoms anymore.
Oh man, that's great. Well, I'm glad that people can learn more about IRC, and if they find themselves suffering with this common problem of hemorrhoids, then they should definitely look you up. Regardless of where they're at in the country, they can come travel, right?
Absolutely. And it's so interesting because, again, this is not widely done in the country. We have a center here in Nashville, but probably the nearest center is over 200 miles away. My other center in the metro area of Louisville, Kentucky, in southern Indiana. So,
okay.
Yeah.
All right. So then you've got two areas. Maybe soon you'll have more, because I also want to talk about how it seems that you are doing some expansion.
Yes.
It started with you have a larger office now.
Yeah, so I have a larger office. we were blessed and moved into this really nice facility here in the Mid-State Medical Building on 2010 Church Street, Suite 526, and we have doubled our size, our office space, and our patient volume, and we're even bringing on additional staff to help see patients.
Great,
yeah.
Great. So besides RSC, what else do you do?
So I'm board certified and trained in family medicine.
Oh, great.
And I've been in practice, this is going into my 16th year,
wow.
Sweet 16.
No way. That's great.
Time goes by fast. And
yes.
So we focus on primary care, prevention, wellness, and the full gamut of those type of exams.
Okay, that's great. Now, I know that you are a Meharry graduate.
Yes.
So you've been around Nashville.
Yes, I have.
Let's talk a little bit about the importance of Meharry. Now, I know Meharry is an HBCU and a medical college.
It is.
How many are there in the country?
That's a good question. As far as there's Howard Medical School.
That's right.
There's I think there's still there's Morehouse School of Medicine.
Yes.
And if there's still Drew in
California.
LA.
That's right.
I think they still have that one. So.
I think 4.
I think it's 4.
Wow.
And I'm very pleased that I'm a product of a HBCU, historically Black College University.
Mm-hmm, yes.
Because they do produce a lot of professionals in the medical profession and between the schools. And I've received, of course, a wonderful education and have worked with the best of faculty, and a lot of my classmates and peers are doing extremely well. I'm just so proud of everybody, and then I'm thankful for my own course and my accomplishments and the foundation that I had at the school.
Now, you also went to undergrad HBCU?
Yes, I went to Spelman College.
Spelman, wow. That's a great university.
Yes. And so I'm glad to be a graduate of Spelman. I love the schools and all the schools there in the Atlanta University Center. You have Morehouse and Clark Atlanta and Morris Brown, and so it was a wonderful time.
Now, if there were any younger viewers that were thinking about attending HBCU, would you have any advice for them?
I would say go for it.
Go
for it. It's a wonderful place to get an education. Those are foundational years. You meet people from all over the country and other parts of the world that come to the schools, and it's just a great foundation to your education and career.
Oh, wow.
And then
That's
the
good.
Nurturing that you get typically at the HBCUs, the mentoring from college professors and the opportunities for
That's
people
great.
of color.
That's great. That's great. Thanks for that information.
Yeah.
Now, before we let you go, we definitely want to give contact information, give address, but website.
Yes, so our website is advancedcarecenters.com, and our phone number is 615-329-7969. And we have 2 locations. We have the Nashville location here. It's on 2010 Church Street, Suite 526, Nashville, Tennessee. We're in the Mid-State Medical Building. And then we have our Jeffersonville, Indiana location. If anyone happens to be near or from that area, it's, that's on 1034 Spring Street, Jeffersonville, Indiana.
Oh, that's great. Well, once again, thanks. I know that you probably got patients out there beating down the door, but you let me come in and interview you today. We really appreciate it.
Yes, thank you for having me. Always a pleasure.
Definitely, thanks. And once again, you've been tuning into another episode of Take 10 on Tuesday with the Tennessee Tribune. We'll see you next time.